I'm going to be talking about reducing the burden of cancer with a plant-based diet. My disclosures include much of what has been said already, but I'll just add that I've been vegan since 2013. So in today's talk, I'd like to review some cancer statistics. We'll talk about why plant-based nutrition may be beneficial in cancer prevention from a pathophysiological perspective. We'll review some examples from the medical literature to highlight the benefits of plant-based nutrition for cancer prevention, for improved outcomes after a cancer diagnosis, the recent evidence for potentially improved treatment response. We'll talk a little bit about the individual components of nutrition. We'll touch on the recent microbiome research, and we'll finish by reviewing the dietary recommendations from the International Cancer Organizations, together with some other resources, and talk about the interaction between nutrition, cancer, and planetary health. So 15% of all deaths globally is from cancer. This is the second leading cause of death worldwide, and in some countries, including Canada, where I'm coming from, it is the leading cause of death. 1 in 2 Canadians will develop cancer in their lifetime, and that's similar statistics in the developed world. Lung, colorectal, breast, and prostate cancer account for half of all cancer diagnoses and deaths, and most of the research are in this setting. The good news is that 50% of all cancers are preventable through modifiable lifestyle factors, as estimated through our cancer organizations and the World Health Organization. 1/3 of all cancers can be prevented by eating well, being active, and having a normal body weight. This study is from the Global Burden of Disease study, which has been around for about 30 years, and this group of over 8,000 researchers from more than 150 countries come together to provide health information globally, so this can inform policy and action. And they estimate that in 2019, I beg your pardon, there were about 23.6 million cases of new diagnosis of cancer, 10 million cancer deaths globally, 250 million disability-adjusted life years due to cancer. And worryingly, since 2010, these represented a 26% increase in new cases, a 21% increase in deaths, and 16% increase in disability-adjusted life years. And cancer was second only to cardiovascular diseases for these metrics. These are statistics from the US from last year, 2024, showing that worryingly, there is an increasing incidence in 6 of the top 10 cancers, and incidence rates are rising annually by between 0.6% and 3%, depending on what cancer you're looking at. We're also seeing a change in the pattern of cancer. Colorectal cancer used to be the 4th leading cause of death in men and women under the age of 50 since the 1990s, but now is the leading cause of death, cancer death in men, and the second in women. We are also seeing a number of other cancers increasing in our under 50 years of age group. And these include our common cancers, including breast and colorectal, other GI malignancies, prostate cancer. So 14 different types of cancer seem to be increasing in our younger age group. And this definitely constitutes an emerging global epidemic or pandemic even. The other worrying feature is that if you have a diagnosis of cancer, you are unfortunately at increased risk of getting a second cancer, an increased risk of dying of cancer. And smoking and obesity-related cancers accounted for the majority of these second cancers, suggesting that the lifestyle factors that are contributing to cancer in general are still ongoing after the diagnosis, and I think reflecting the fact that we need to do a better job of educating our people on lifestyle factors. We also know that cancer treatment itself can cause long-term consequences, such as cardiometabolic diseases, including fatty liver disease, cardiovascular disease, but also second malignancies, cognitive impairment, and bone health issues. In addition to the huge psychological burden, there's also a cost burden. This is data from Canada specifically. We have a national health system And even with that, 20% of cancer costs are paid by people with the diagnosis of cancer and their caregivers. It is recognized that only 5 to 10% of cases of cancer are due to the genes that we are born with. And as we've already mentioned, 40 to 50% are due to modifiable lifestyle factors. And this is reflected in our guidelines. Here are the guidelines from the Canadian Cancer Society, suggesting that we should live smoke-free, be sun-safe, have a healthy body weight, eat well, move more, sit less, and limit our alcohol intake. So what is a healthy diet? We can say that a healthy diet from the decades of literature that we see is plant-based. There's no official definition for what plant-based is, but if you look at the literature, it really represents a diet pattern that's at least 85% from the diet. So this could be vegan, vegetarian, it could be a Mediterranean-style diet. It should have mostly whole foods and it should be low in saturated fat. It must also be sustainable, affordable, accessible, and culturally adaptable. And this is important when we're talking to our patients about these changes. It should also be just, compassionate, and not harmful to our planet. Oh, I'm sorry. I've managed to stop my sharing. Excuse me 1 second.
We still see your screen, but there is that blue bar on top from the math book.
Thank you. I'm sorry about that.
Okay.
Yes, now I've lost my way to move forward.
John, are you able to assist?
Yeah, Dr. Kassam, do you want to, hold on. Here, we'll stop sharing and then reshare your screen with us. Come back to the Zoom window and then hit the share with the green arrow pointing up.
I'm so sorry about that. Thank you. I can see myself again, and hopefully you can as well.
Yeah, we see your slides too. You want to cycle them through?
Thank you. We now see that the decades of evidence we have for the benefits of plant-based nutrition are now in our national and international consensus and our guidelines, including our cancer guidelines from the World Cancer Research Fund, the American Institute of Cancer Research, our American Cancer Society guidelines, and also the cardiovascular guidelines globally. Our Canada Food Guide is one of our best country-based guidelines, I think, which promote a plant-based diet as well. So let's talk a little bit now about the underlying mechanisms of disease. This is a wonderful graphic from our lifestyle medicine literature, and it really helps us conceptualize how disease develops in the body. They talk about 3 main pathophysiological features, including microbiome alterations, epigenetic changes, the changes in the expression of our genes, cellular stress, and injury. And these mechanisms contribute to inflammation in the body. Inflammation in the body then has an effect on those original pathways and amplifies them, and you get a vicious cycle. And this then can manifest in different diseases in people, including our common diseases of obesity, type 2 diabetes, cardiovascular disease, cancer, depression, and other diseases. The good news is that lifestyle interventions can help all of those aspects, and we know that unhealthy diet, sedentary lifestyle, high stress environments, medications, poor sleep, addictions, and social isolation do negatively impact these processes in our body. In the cancer literature, we see this reflected, and as oncologists, we all learn about the hallmarks of cancer written by the great Dr. Hanahan, and this has recently been updated in 2022. And this paper synthesizes all the evidence we have looking at what contributes to cancer development, and they talk about 8 hallmark capabilities of cells that they take on to start behaving like a cancer, including things like evading the immune system, developing their own blood vessels, avoiding cell death. And they also talk about enabling characteristics. So these are characteristics that work together to help cells take on these capabilities to become cancer. And amongst those enabling characteristics include tumor-promoting inflammation and genome instability and mutation. And in the latest iteration, emerging characteristics include epigenetic reprogramming and polymorphic microbiome. So you're seeing the same features represented in cancer as you are in other diseases. So how can whole food plant-based nutrition help all these aspects that we've been talking about? Well, plant-based nutrition is anti-inflammatory. We see from the studies that from looking at markers of inflammation and the disease patterns, whole food plant-based nutrition is anti-inflammatory. So it can contribute to combating chronic inflammation. You can avoid carcinogens such as processed meat by having plant-based nutrition. You can promote a healthy gut microbiome. It's increasingly recognized the central role that the gut microbiome has in diseases, and we're seeing more of that research coming out in cancer as well. It can help combat obesity. It's a great way to maintain a healthy body weight, and we see that from the studies. It can help regulate hormone and growth factor dysregulation. We see better profiles for insulin-like growth factor, for example, lower in vegans and vegetarians, and insulin-like growth factor has been implicated in cancer development because it helps promote proliferation of cells and it reduces cell death. We know that plant-based nutrition can reduce hyperlipidemia, so you can have a better cholesterol profile. It improves insulin resistance and oxidative stress, all of which have been implicated in cancer development. The other really important thing to say is that whole food plant-based nutrition can reduce the risk of other chronic diseases, these comorbidities, which by themselves increase your risk of cancer, and we'll talk more about that later. So multiple ways that plant-based nutrition can be beneficial. So I'm going to review some of the studies showing the benefits of plant-based nutrition for cancer incidence. It's great to see reviews like this in the medical literature. This is from 2022 in one of our high-impact journals, the Journal of the American Medical Association, by two clinicians from the Memorial Sloan Kettering Cancer Center, one of our top cancer centers worldwide. And they reviewed all the literature looking at plant-based diets and ketogenic diets in cancer prevention and management. And the results of this review suggest that the collective evidence supports plant-enriched diets versus ketogenic diets for the reduction of cancer risk and the improvement of metabolic disorders in survivors. So this is a great overview of the literature that we have. I really recommend reading this. Two of the most famous studies that are quoted in terms of nutrition and health outcomes are the Adventist Health 2 study and the Epic Oxford study. These cohorts have been running for decades. They have thousands of participants, and they have a third of their participants who are either vegetarian or vegan, making them ideally suited to study nutrition patterns and health outcomes. The Adventist Health study has more than 96,000 Seventh-day Adventists from America and Canada. They've been ongoing since 2002, and they have shown that there is an 8% reduced risk of getting cancer if you are lacto-ovo-vegetarian, a 16% reduction in cancer risk if you are vegan, and quite a high reduction in the male-specific and female-specific cancers by 34 and 35%. The Epic Oxford study, which is running in the UK, is over 60,000 participants, again running for many decades, and have shown similar figures, 11% reduction in lacto-ovo-vegetarians and 19% reduction of cancer risk amongst the vegans. Here is a review from 2012 of 7 studies, including these 2 studies we've just mentioned, over 120,000 subjects, showing that vegetarians have a 18% lower overall cancer incidence. Here's a more recent review from 2017 showing that 15% reduced risk of cancer occurs in vegans. Since then, we've also had studies coming out from the UK Biobank. This has been running since about 2006, has currently over 500,000 participants, and has been described as one of the most important cohorts globally to study health outcomes. And this study from 2022 had over 470,000 participants followed for, on average, 11 years. And participants are categorized into regular meat eaters, meaning they ate more than 5 times per week, meat more than 5 times per week, compared to low meat eaters, fish eaters, and being vegetarian. And this study found that if you were a low meat eater compared to a high meat eater, you reduced your risk of all cancers combined by 2%. And that might not sound very much, but if we go back to the absolute figures that we have for cancer and that high burden, 2% does actually represent quite a large number of people. If you were pescatarian, you reduced your risk of all cancers by 10%, if you were vegetarian by 14%. So we're again seeing these stepwise benefits. When we look at the specific cancers, for bowel cancers, low meaters had a 9% reduced risk of getting bowel cancer compared to regular meat eaters. In breast cancer, postmenopausal vegetarian women had an 18% reduced risk of getting breast cancer, but this actually disappeared when you accounted for body mass index. For prostate cancers, the numbers were even higher. If you're a pescatarian, you reduce your risk of prostate cancer by 20%. If you were vegetarian, by 31%, similar to that figure we saw in the Adventist Health study too. We also have lots of data coming out of the French cohort, the Nutrinet Santé cohort. This has over 54,000 subjects followed for a median of 4 years, and they looked at the plant-based dietary score and associated it with health outcomes and found that there was an overall reduction of cancer incidence by 15%. Here is a massive study. This came out in 2022, and it looked specifically at plant-based diet and the risk of digestive system cancers. And we remember there are several of the digestive system cancers that are increasing in incidence in our younger population. And this study had over 3 million subjects, and they found that overall plant-based diets had a protective role in the risk of digestive system cancers with an overall risk reduction of 18% and differing by cancer site, but overall significant reductions. There is not much data in our hematological malignancies, but now we are seeing more data in this setting from the team at Memorial Sloan Kettering with Dr. Urvi Shah. And here is one of them. This study looks at multiple myeloma. It's the second most common hematological malignancy. It's one of the ones that are increasing in incidence. And they looked at over 400,000 participants, and higher healthy plant-based dietary index scores were associated with a 17% reduction in getting multiple myeloma. Previous studies, these are from the Harvard cohorts, the Nurses' Health Study and the Health Professionals Follow-up Study, showed that there was a 15 to 20% lower mortality related to multiple myeloma as well. So plant-based diets may well have a role to play in these malignancies as well. So what about if you have a diagnosis of cancer? Can you change your outcomes? And the answer is yes. So it's never too late to make the changes that will benefit you. When we look at what the causes of death are, this is the Global Burden of Disease study again. In 2017, they estimated that there were 11 million deaths, and cardiovascular disease and cancer were the leading cause of diet-related deaths. They also found that suboptimal diet was responsible for more deaths than any other risk globally, including tobacco, and that improvement in our diet could potentially prevent 1 in 5 deaths globally, of which we've just said cardiovascular disease and cancer are leading causes. The top dietary risk factors are too high an intake of sodium, which I think is a reflection of our processed food intake, and too low an intake of whole grains, fruits, nuts and definitely something to promote. Here is another study from 2023, a systematic review and meta-analysis, and this study included 22 prospective cohort studies on cancer looking at over 57,000 participants, and they found that a greater adherence to a plant-based diet was associated with a 12% reduced risk of dying from cancer, and of course other benefits in terms of reduced risk of cardiovascular disease and all-cause mortality. This next study is actually one of my favorite studies. This is from the Harvard cohort. It was published in 2018, and it looked at the impacts of 5 healthy lifestyle factors on life expectancy in a US population. So they included over 170,000 men and women from the Nurses' Health Study and from the Health Professionals Follow-Up Study. The 5 healthy lifestyle factors that they looked at included moderate alcohol intake rather than excess moderate alcohol intake, never smoking, physical activity, healthy weight, and a healthy diet. And these cohorts don't have a high number of vegetarians and vegans like the Adventist Health 2 study and the EPIC Oxford study. So they use the alternate healthy eating index to score the dietary pattern, which was an index developed by the Harvard group. And they score higher marks for higher intake of vegetables, fruits, whole grains, unsaturated fats, and omega-3 fats. They score higher, better for lower intake of red meat, processed meat, sugar-sweetened beverages, trans fat, and salt. And they found that if you had the best diet according to the alternate healthy eating index, you were 30% less likely to die from cancer. If you had all 5 of these factors, there was a 65% reduced cancer mortality with all 5 factors. So this is quite incredible statistics. And similarly, they found benefits for cardiovascular disease mortality as well. Interestingly, if you were doing all these healthy lifestyle factors when you were age 50, men lived 12 years longer, women lived 14 years longer, and this has been replicated in other studies since then as well. So plant-based nutrition definitely increases the number of years that we live. Our nutrition research is often criticized for not having enough randomized control studies considered the gold standard of studies. And this is, because it's hard to do nutrition studies following people for many years. It's expensive. It's hard to get people to adhere to nutrition patterns. But here is one study. This was published in 2020. This is the results of the Women's Health Initiative randomized study looking at over 48,000 postmenopausal women over the age of 50, followed up for nearly 20 years. And they randomized this group of patients to standard of care in terms of dietary intake, which reflected a dietary fat intake of 32% or more. For the intervention group, they asked the participants to increase their fruits and vegetables to 5 servings a day, increase their grains to 6 servings per day, and reduce their fat intake to about 20% of calories. And after their follow-up of, as we've said, a median of 20 years, there was a 15% reduction in the risk of death after breast cancer and a 21% reduction in death from breast cancer, concluding that a low-fat dietary pattern associated with increased vegetable, fruit, and grain intake significantly reduces the risk of death from breast cancer in postmenopausal women. So I think strong data supporting the move to more plant-based foods in our diet after a cancer diagnosis. Here is another study looking at colorectal cancer, looking at the diet quality before diagnosis and after diagnosis. Nearly 3,000 participants in the cancer prevention study 2 nutrition cohort, and they concluded that dietary patterns reflective of high intakes of plant foods and low intakes of animal products before and after a colorectal cancer diagnosis are associated with a longer survival. We are seeing more studies coming out in prostate cancer as well. Here is one from the Health Professionals Follow-Up Study from Harvard, published in 2022, looking at over 47,000 men. In that cohort, over 6,500 men were diagnosed with prostate cancer. Those eating a healthy plant-based diet had a 16% reduced risk of prostate cancer, but they also had a 44% reduced risk of lethal prostate cancer, which was defined as prostate cancer causing death or the presence of metastases. Findings of these studies support the evidence that greater consumption of healthful plant-based foods are associated with lower risk of aggressive forms of prostate cancer. And no talk on cancer would be complete without mentioning Dr. Dean Ornish's studies in early prostate cancer. Dr. Dean Ornish is described as the godfather of lifestyle medicine, and amongst many other studies and research that he has done, he did a number of studies on patients with early prostate cancer. And at this stage of prostate cancer, patients have the choice of undertaking active surveillance. So this means regular clinical examination, regular blood work with PSA. This is a blood marker indicating the activity of prostate cancer, and regular biopsies of the prostate. So you can undertake active surveillance, and only if you progress, that's when you would come in with the definitive cancer treatments of surgery or radiation or hormonal treatment. So his first study looked at about 93 patients with early stage prostate cancer. He randomized them to standard of care or intensive lifestyle changes. And the intensive lifestyle changes included a low-fat, plant-based diet, group support, physical activity, and stress management. And in their study, they found that PSA at 1 year on average increased in the standard of care group, which is what you would expect to see. But in the intervention group, there was on average a lowering of their PSA. And at 2 years, 27% of the standard of care group had required intervention with radiation or surgery or hormonal treatment, compared to only 5% of the interventional group, providing evidence to suggest that once we have a diagnosis of cancer, we might be able to change the trajectory of the disease. The other interesting studies he did, he looked at telomerase activity in the peripheral mononuclear cells at 3 months, and found an increase in telomerase activity, which is what we want. This helps protect the telomeres, the caps at the end of chromosomes. And when he looked at 5 years at the telomere length in about 30 of these patients, he found that there were longer telomeres compared to people who had not undergone the lifestyle medicine intervention. The other really fascinating study that was done was in a group of 30 of these patients or so. Prostate biopsies before the intervention and 3 months after the lifestyle intervention were reviewed, and it was found on genetic analysis that there were about 500 gene transcripts that were changed, showing upregulation and downregulation in genes. So you can change the expression of your genes. And when they looked at the functions of these gene transcript, many of them were related to pathways related to cancer development. So this is really incredible data, hypothesis generating, that by changing your lifestyle, you can change the expression of your genes. Since then, we've seen a couple of other studies looking at prostate cancer and progression. Here is one of them from last year. This is over 2,000 men with biopsy-proven non-metastatic prostate cancer, followed for a median of 6.5 years. And they found that amongst those patients who had Gleason grade 7 or higher at diagnosis, so this is the more high-risk population, those who were having more of the healthful plant-based foods had a 55% lower risk of progression compared to those who are having the least amount of those plant-based foods. So again, these findings are suggesting that consuming a primarily plant-based diet may be associated with better prostate cancer-specific health outcomes. And I think there's enough data here really to be counseling our patients on this. So what about quality of life? This is equally important in management of cancer. And here is another study in prostate cancer. This is quite unique in looking at long-term quality of life after prostate cancer treatment. And we know that unfortunately, even though these treatments are great in terms of cure, they do leave patients with quite significant impacts on their sexual function, their urinary function, their hormonal health, and sense of vitality. And in this study, this again is from the Health Professionals Follow-Up Study from Harvard. They looked at 3,500 men with non-metastatic prostate cancer, and 48% of this group had had surgery, a radical prostatectomy to remove the whole prostate. 35% had had high-dose radiation, and they looked at their long-term quality of life. The median time from undertaking the quality of life questionnaire from the time of diagnosis was 7 years. And they found that a higher plant-based dietary index score was associated with better functioning scores for sexual function, urinary irritation and obstruction, urinary incontinence, and hormonal health and vitality. Those patients who consumed the most plant-based foods scored 8 to 11% better in measures of sexual function than those consuming the least. There were 14% better scores for urinary health, 13% better scores for hormonal health, marked by symptoms of low energy, depression, and hot flashes. And for those oncologists who treat prostate cancer, for people who have gone through this, we know that these are very difficult symptoms to deal with, and having dietary changes that can be sustainable and that have been shown now to be of potential benefit, I think is very important. We don't have many interventional trials in the setting of metastatic cancer. So this is really great to see this. This is from Dr. Campbell's group. It's a small study published last year looking at women with metastatic breast cancer who are on stable systemic treatment. And they were randomized to either a whole food plant-based dietary intervention or usual care for a period of 8 weeks. The food was provided to them. There were 20 people in the intervention group, 10 in the control group, and it was found that the intervention group were very adherent to the whole food plant-based diet. And at 8 weeks on their measures of these outcomes, there was an improvement in cognitive function and emotional well-being in the group that had the whole food plant-based diet intervention, and fatigue severity improved as well. And again, we know that these are really debilitating symptoms with people that we are seeing in clinic. So this is really great to see. This was another study looking at the same population of metastatic breast cancer with patients who are on stable systemic treatment, again with the 8-week intervention of the whole food plant-based diet. And they found that in the intervention group, mean weight reduced by 6.6%, fasting insulin decreased, insulin resistance improved, total cholesterol improved, LDL cholesterol improved. And the study showed that these changes in diet were well tolerated and significantly improve all these parameters that we've just mentioned. Longer term studies are warranted to see the duration of these studies, but this is really tantalizing evidence because we know that weight does impact how you do after a diagnosis of cancer. So weight management is important, but also insulin resistant, fasting insulin levels, and cholesterol levels are thought to be contributors to an environment that promotes cancer. So very interesting evidence. So what about diet during cancer treatment? We've just mentioned the study for patients with metastatic breast cancer that came out last year, but there are also other studies suggesting that what we eat and how what lifestyle factors we undertake during cancer treatment can improve our response to treatment and might help how we do in terms of outcomes. So this is a study that came out in 2023. This looked at stage 1 to 3 breast cancer patients who are undergoing neoadjuvant chemotherapy, that is chemotherapy before their definitive surgery. So this is for curative intent. And patients were randomized to standard of care or a home-based exercise and nutrition intervention. The nutrition intervention was described as a predominantly plant-based diet. And really interestingly, the patients who had this lifestyle intervention had an improved pathological complete response rate from 53% versus 28%. And this means that when they came to surgery and looked at their specimens under the microscope, there was no sign of any cancer left behind. And so not only does this suggest that what we eat might improve how we respond to treatment, but pathological complete response rates in the setting of breast cancer has been shown to improve your prognosis. So again, very interesting data. Here is another study looking at patients with advanced melanoma who are being treated with immune checkpoint blockade, which is a type of immunotherapy, which, as we know, there's a great burgeoning of immunotherapy options for different cancers now. This is a systemic treatment that uses the body's own immune system to help combat and attack cancer cells. So this study came out a couple of years ago, 91 patients from the UK and the Netherlands, all of whom were on these immunotherapy treatments, and they looked to see what the outcomes were compared to the diet pattern, and they classified the diet pattern according to the adherence to the principles of the Mediterranean diet. And we know the Mediterranean diet is really a plant-based diet which prioritizes fruits and vegetables and whole grains, legumes, nuts and seeds, and fish, and is low in red meat and processed meat. And when they looked at the Mediterranean diet score, so on the x-axis along the bottom, you can see 0 to 5. So 5 is the greatest adherence to the Mediterranean plant-based score. And on the y-axis, you can see the probability of response to treatment. It's a straight line almost, showing that the more adherent you were to a Mediterranean diet, the higher your probability of a response. And these findings suggest a potential role for diet in improving the responses to immune checkpoint blockade treatment outcomes. And the authors hypothesized that a potential mechanism underlying this association may be the gut microbiome. We're going to talk about this later. And there are other studies showing that diet can impact your response to treatment as well. Here is another study looking at plant-based diet and survival in patients with metastatic colorectal cancer. This subgroup was actually part of a larger National Cancer Institute sponsored study, and it was looking at patients with metastatic colorectal cancer who are undergoing chemotherapy. And they looked at about 1,284 patients who had completed food frequency questionnaires at the start of their chemotherapy treatment, and they found that compared to the lowest intake of plant-based foods, those who were having the highest intakes based on the plant-based dietary index score had a significantly better chance of survival. So a 24% increased chance of survival. Again, adding to the evidence that what you eat during your treatment can help how you do. So moving on to some of the individual dietary components now. Although we like to talk about dietary patterns, there's a lot of evidence looking at the dietary components as well. Here is a dose response meta-analysis of 95 studies published in 2017 looking at fruit and vegetable intake. And they found that the more fruits and vegetables you ate, the lower your risk of getting cancer, and intakes up to 600 grams per day was associated with a reduction in cancer risk, which translates into about 10 portions of fruits and vegetables a day. But any increase is going to show you a benefit, as we've seen in other studies. This is a systematic review from 2016 looking at whole grains, looked at 45 prospective studies, and they found for every 90 grams a day of whole grains, there was an associated 15% reduction in the risk of dying from cancer. Here is a study looking at legumes. This is from the Preventive study, looking at over 7,000 participants, following them up for a median of 6 years. Findings that total intake of legumes and higher lentil consumption was associated with a lower risk of dying from cancer. When we talk about legumes, we have to talk about the soybean. There is so much misinformation about the soybean. We hear all sorts of things, that soy is going to increase the risk of breast cancer, man boobs. It's destroying the Amazon. Of course, none of these are true. When it comes to health, there are so many human studies that have shown the health benefits of eating soy, lots of benefits for cancer, but also for cardiovascular health as well. Tofu is one of the few foods that has a heart health label on it because it helps reduce cholesterol and resulting heart disease. In terms of cancer, we have, as I said, lots of data. Here is a review, it's an umbrella review of the systematic reviews and meta-analyses done on observational studies and randomized trials in humans. It was presented in 2019, and they showed that there was a significant reduction in the risk of a number of different cancers with higher intake of soy, including ovarian cancer, gastric, prostate, breast, colorectal, endometrial, and lung cancer. Another study published the same year looked at soy intake in relation to mortality from different causes, including cancer and cardiovascular disease. And they included 23 prospective studies, over 330,000 individuals, showing that higher intake of soy results in lower risk of death from cancer. For every 10 milligrams per day intake of soy, there was a 7% reduction in mortality from all cancers. When looking at breast cancer specifically, for every 5 grams per day, this was associated with a 12% reduction in breast cancer deaths. And there's been multiple studies specifically in breast cancer, where a lot of the misinformation comes from. And it's important to say that the studies do show a reduced risk of breast cancer recurrence and dying of breast cancer in both hormone positive and hormone negative disease. What about fiber? We know about the benefits of fiber for all our chronic diseases, and that includes our cancers as well. And fiber is an essential component of the diet. Most of us, we know we're not eating enough. We should be eating at least 30 grams a day. It's only found in whole plant foods. And we know that a high fiber diet or higher fiber diet is associated with a better, more healthy gut microbiome. And this picture is Dr. Dennis Burkitt, who is probably better known in oncology circles for his work with lymphoma, with Burkitt's lymphoma, but actually he did a lot of work looking at fiber. He was a missionary in Africa, and he noticed that in Africa, they had a much lower incidence of diseases of the colon, diverticulitis, and colon cancer. And he said this famous quote that societies that eat unrefined foods produce large stools and build small hospitals, and societies that eat fiber-depleted foods produce small stools and have to build large hospitals. And when we come to cancer and fiber, there are multiple studies showing that higher fiber reduces your risk of colorectal cancer, it reduces your risk of dying from colorectal cancer, and it reduces overall mortality. It's been shown in breast cancer to reduce the risk of getting breast cancer as well. I'm going to mention a few special superstars in this setting as well. We've already mentioned soy, but the cruciferous vegetables have been found to have anti-cancer activity at the cellular level. These are sulfur-containing compounds, the glucosinolates, which are converted by cooking and chewing to indole-3-carbinol on sulforaphane, which are biologically active and have anti-cancer activities. Mushrooms, they contain beta-glucan, which is a type of fiber. There have been multiple studies on mushrooms, and they show that they reduce cancer risk, predominantly in breast cancer, by 44%. We know that tomatoes and the red-colored fruits and vegetables that contain lycopene, which is one of the carotenoids, are associated with a lower risk of prostate cancer. In the allium family, garlic, onions associated with the risk of some cancers as well. Flax seeds, multiple studies here. Flax seeds contain lignans, which are a type of phytoestrogen, which have been shown to reduce the risk of cancer, including in breast cancer and prostate cancer. So these are all foods that I encourage my patients to include in their diet. I often have my patients say to me that they give up caffeine and coffee. And actually, there is not data to suggest harm from drinking coffee. In fact, the opposite. And this is a great review from Dr. Walter Willett and colleagues looking at the evidence reviewing coffee and health. And overall, there seems to be a benefit in reducing overall mortality, and there may be an association with the reduced risk of liver cancer, of endometrial cancer, and perhaps the most strongly related to reduced colon cancer, which is now actually in our guidelines, which we will come to later. So what about the bad foods? So processed red meat, or processed meat in general and red meat are carcinogens. In 2015, the World Health Organization classified processed meat as a class 1 or group 1 carcinogen. It's in the same group as smoking and asbestos and plutonium. And that means in that group, we have the strength of evidence is so great that we are pretty certain that processed meat causes bowel cancer. And red meat has been classified as a group 2A carcinogen, means that it probably causes bowel cancer. And red meat does include pork. I do mention that because a lot of my patients are not aware that pork counts as a red meat. And since this, there have been many studies linking processed meat and red meat to other cancers as well. Interestingly, when we look at the data on the perception of this, one study, for example, done in Toronto by Vegetio, one of our Toronto-based vegetarian organizations, suggested that over 50% or more of the population are either unaware of this data or are skeptical with relation to this. So we definitely have to do better education in this area. So why are processed meats and red meats carcinogenic? Well, processed meat contains nitrates and nitrites, which are converted in the gut to N-nitroso compounds, which are thought to be carcinogenic. All meats contain heme iron, which are pro-oxidant and been linked to DNA damage and inflammation. All meats, when you cook them, they produce cancer-causing chemicals such as heterocyclic amines and polycyclic aromatic hydrocarbons. All meat and fish are high in saturated fat, which have been linked to cancer development. The persistent organic pollutants in the environment, they go up the food chain, they sit in the fat of animals. All meat increase your levels of IGF-1, insulin-like growth factor 1, that we've already mentioned, provide a growth environment, they promote cell proliferation, inhibit cell death, and all of these meat products contain estrogen, which may be implicated in the development of the hormonally related cancers. It's important to say that meats are devoid of fiber, antioxidants, and phytochemicals, all of which is so important in a healthy diet. And more recently, red meat and processed meat have been associated with a particular type of alkylating DNA damage, and people who have this have an increased risk of dying from colorectal cancer. Here is one study showing the link between animal protein, IGF-1, and cancer. This was a study from 2014 with 18 years of follow-up in nearly 7,000 people in the US. High protein intake was linked to increased risk of cancer, diabetes, and overall mortality. Those eating a diet with more than 20% protein under the age of 65, particularly if it was animal protein, had a 4 times increase risk of death from cancer compared to a low protein diet. And if you had high IGF-1 levels, you potentiated that relationship between mortality and high protein. So the higher insulin-like growth factor levels, the greater the relationship. And we know that when we look at people with different dietary patterns, vegans and vegetarians have in general a lower level of IGF in their plasma. So this is the study relating to DNA damage caused by red meat and processed meat. This was done in the Nurses' Health Study and the Health Professionals Follow-Up Study, looking at 900 patients with colorectal cancer who underwent DNA sequencing of matched normal tissue and the colorectal cancer tissue. And this study found there was a particular mutation signature in the colorectal cancer tissue associated with alkylation of the DNA, indicating a type of DNA damage. And this signature was associated with higher intakes of processed meat and red meat in the participants. And tumors that had this signature were more likely to have mutations in the genes associated with driving the development of colorectal cancer. And the other part of it was that those who had higher levels of this damage had a 47% increased risk of dying from cancer. And the study authors conclude that their study identified for the first time an alkylating mutational signature in colon cells, linked it to red meat consumption and cancer driver mutations, adding further support that red meat intake is a risk factor for colorectal cancer. Here is another study looking at breast cancer, looking at the intake of dietary fat, and they found that on looking at 15 studies, that the more saturated fat you ate, the higher your risk of breast cancer specific death. So when they look at the highest category compared to the lowest category, there was a 49% increased risk of death. And we know that saturated fat intake is really from your animal products. It's very little from plant intake. So again, I do tell my patients to try and limit their animal product intake to less than 15% less if possible. What about dairy? So this is a fantastic review actually by Dr. Willett and Dr. Ludwig in the New England Journal of Medicine in 2020. And they say the health benefit of a high intake of milk products has not been established, and concerns exist about the risks of possible adverse health outcomes. So, we know that the dairy industry has done a fantastic marketing campaign to make us all think that dairy is absolutely essential for health, and this is not true. We remember that 70% of our global population is lactose intolerant. We're the only species that drink the milk of another species. We're the only species that drink milk beyond being babies and beyond weaning. And when we look at the link between cancer and dairy, there is quite a strong link between prostate cancer and dairy consumption. And here is a meta-analysis of 32 prospective studies, which was done as part of the World Cancer Research Continuous Update Project, looking at the intake of dairy products and calcium and prostate cancer risk. And this showed that high intakes of dairy products, milk, low-fat milk, cheese, total calcium, dietary calcium, dairy calcium was associated with the increased risk of prostate cancer, but supplemental calcium and non-dairy calcium was not associated with an increased risk of cancer. And these results suggest that there are other components of dairy rather than the fat or the calcium that may increase prostate cancer risk. For colon cancer, the evidence suggests the opposite, actually. So there have been multiple studies suggesting that dairy reduces the risk of colon cancer. But if you look at those studies, when you account for calcium intake, that link disappears. So it's more about the calcium than it is about the dairy. And it's thought that the calcium helps to bind the secondary bile acids that are produced in the gut, which are carcinogenic, and help remove them as waste. And this is the latest study that was published just this year, and this looked at 471 or more healthy adults over the age of 50, studied for more than 20 years, and they found that the higher calcium you had, the lower the risk of colorectal cancer. So comparing the highest intake to the lowest intake, there was a 29% reduced risk of getting colorectal cancer. But the authors specifically state that this was regardless of the source of calcium. However, when you looked at the headlines at that time, the dairy sites and the news outlets, it was all about milk reducing your risk of bowel cancer, including on some of our cancer websites. So this is Cancer Research UK, bowel cancer risk could be reduced with an extra glass of milk, which I think is somewhat misleading, given that it is any source of calcium and not very respectful to our community, which doesn't drink milk for various reasons, whether it's health or ethical or environmental reasons. In breast cancer, the literature is pretty mixed. So the guidelines actually don't make a recommendation as to not having dairy in the setting of breast cancer. However, there are some studies that do suggest a link. Here is one of them. This study came out in 2020, studied over 50,000 North American women, followed for 8 years. And this found a dose response association between the intake of dairy milk and the risk of breast cancer. If you were drinking half a glass of milk a day, you increased your risk of breast cancer by 30%. If you drank 1 cup a day, you increased your risk by 50%. If you drank 2 cups by 70%, 3 cups by 80%, respectively. And this was the same for full fat, reduced fat, non-fat milk. When they looked at people drinking soy rather than dairy, there was a 32% reduced risk of breast cancer. So, given studies like this, I do suggest to my patients that we should use the precautionary principle and think about switching from dairy milk to soy milk. And that way we can get rid of the potential negative aspects of dairy. We can have the benefits of the soy that we've already mentioned. We can get good protein, good calcium as well. So I really do think that there are better choices to make rather than dairy for cancer risk, but also other risks as well. What is it about dairy that might be associated with this increased cancer risk? Well, we know that the current practices are to milk cows when they are pregnant. Cows only produce milk if they've had babies, and milking cows when they're pregnant as well means that there are higher levels of estrogen in the milk. There are growth hormones in the milk. This is a growth fluid designed to put on 400 or more pounds on a baby cow in a short space of time. We actually don't want our cells undergoing additional proliferation. It has pesticides. We talked about the pollutants going up the food chain and sitting in the fat of animals. It does contain saturated fat, which has been linked to cardiovascular disease as well as cancer. You're going to increase your levels of IGF-1, which we've already talked about. The sugar in dairy, galactose, has been shown to be pro-inflammatory as well, possibly linked to ovarian cancer. And the protein casein in milk has been linked to breast cancer as well. What about processed food? Unfortunately, we're really seeing a big shift in our consumption of processed food over the last few decades. This was data from 2019, a survey in Canada showing almost half of food consumed in Canada is ultra-processed. We're also seeing more worrying statistics. A few years ago, there was a survey done in the US in adolescents showing that up to 80% of the intake was from ultra-processed foods as well. And there have been a number of studies now coming out showing the link between processed foods potentially increasing cancer risk. The Nutrinet Santi study, which we've talked about, a number of studies have come linking ultra-processed foods, sugary drinks, artificial sweeteners, emulsifiers to increase cancer risk. Here is a recent study just from this year looking at the degree of food processing and colorectal cancer risk in the EPIC study. So this is the big study, the European Prospective Investigation into cancer involving 10 European countries. This looked at 450,000 participants and found that for every 10% increase in the proportion of ultra-processed foods, this was associated with a 6% higher risk of colorectal cancer, and diets richer in unprocessed foods were associated with a lower risk of colorectal cancer. What about alcohol? Unfortunately, alcohol does increase the risk of 7 types of cancer. It's true for all kinds of alcohol, including red wine. Alcohol can increase estrogen levels and insulin levels. The breakdown product of alcohol, acetaldehyde, causes DNA damage. Alcohol can increase absorption of other toxins into cells. It can act synergistically with smoking, and it can negatively impact the microbiome and cause epigenetic changes. The cancer societies do say it is just best not to drink from a cancer perspective. What about weight? Unfortunately, being overweight and obese increases our risk of 13 different types of cancer. In addition, being overweight can increase your risk of getting cancer back again and increasing your risk of dying from cancer. We know from the surveys of US and Canada and UK that a significant portion of our population is now overweight and obese. In 2022, 30% of adults in Canada were obese, 35% were overweight, and we're seeing this increasingly in our adolescents as well. When you have increased fat, you increase the levels of estrogen and insulin and other growth factors in our body, and it causes a state of low-grade inflammation, which, as we've said, is a core feature of many of our chronic diseases. And we know that plant-based nutrition can help maintain an ideal body weight, and we see from the studies looking at different diet patterns that people who are eating a more plant-predominant diet, vegans and vegetarians, for example, in the Adventist Health Study, were in the ideal body weight category compared to the other diet patterns. What about the other comorbidities in cancer? Unfortunately, having a comorbidity does increase your risk of getting cancer and dying from cancer. This actually does make sense if we think back to the original discussion we have, that most chronic diseases do arise from common mechanisms. We have a number of studies showing the increased risk of cancer in different disease settings. In 2018, there was a study from Taiwan looking at over 400,000 participants, and that showed that chronic diseases contributed to more than 1/5 of the risk of getting cancer and to more than 1/3 of the risk of dying from cancer. In addition, people who have comorbidities may need to have treatment adjustments, lowering the dose of chemotherapies, for example, or sometimes not even able to have those treatment options that might be best in terms of treating the cancer. And people with comorbidities might be more at risk of having complications as well. So it's really important that we talk about aggressively managing comorbidities when they start. That will help reduce the risk of cancer and also improve the chances of successful treatment if we do get a diagnosis of cancer. There have been multiple studies looking at this. This is one from just this month, looking at comorbidity in midlife and cancer outcomes. This was from the prostate, lung, colorectal, and ovarian screening study, looking at approximately 130,000 individuals over the age of 55, followed for about 20 years. The participants were categorized according to their comorbid conditions. They looked at 5 different categories: cardiovascular disease, GI conditions, respiratory conditions, liver conditions, and metabolic conditions. And the risk of any cancer was higher if you had a respiratory comorbidity or a cardiovascular condition. Each of these comorbid conditions were associated with the increased incidence of at least one type of cancer. For the metabolic conditions, obesity or type 2 diabetes, significantly associated with a higher risk of 9 cancers. And additionally, these comorbidities were associated with a higher risk of cancer death. And as I said, we have multiple other studies showing this as well. What about low carb diets? We obviously know about the fad for low carb diets at present. I get a lot of questions on this from my patients. When we look at the studies that there are looking at more long-term follow-up, we see actually a negative outcome for low carb diet. So here is one from the Harvard cohort again, published in 2010, looking at 85,000 women, 45,000 men. And they found that an overall low carbohydrate score was associated with a 12% increase in overall mortality. If you had an animal-based low carbohydrate score, you increase your cancer mortality by 28%. A higher vegetable low carb score, conversely, was associated with a lower all-cause and cardiovascular mortality. When we look at this study from 2019, looking at low carbohydrate diets and all-cause and cause-specific mortality, this study of 25,000 participants followed for about 6.5 years showed that those who are having the lowest carbohydrate intake had the highest risk of overall mortality, 32%, and also increased cancer mortality, 36%. They did an analysis on prior 9 prospective cohort studies as well and found similarly an increase in cancer mortality. This study, which was published in 2021, this looked at the ketogenic low-carb diet as an additional treatment on cancer treatment. So there are studies, animal studies, and also some small human studies looking to see if the ketogenic diet may help improve cancer outcomes. And basically, they concluded that there was inadequate evidence to support the beneficial effects of low-carb ketogenic diets on anti-tumor therapy. And this is the review that we've already mentioned that did look at plant-based diets and reviewed the ketogenic diet data as well, and also showed there was no convincing evidence that ketogenic diets can reduce cancer risk. Moving on now to the gut microbiome, it's such a interesting area of research. This area of research has really burgeoned over the last 15 years because of the improved techniques which have come along to help study the gut microbiome. I love this picture on this journal, which has two researchers in a boat going through the ecosystem of our gut microbiome, and very interesting data is coming out. We know that the gut microbiome is being linked to a number of diseases, and there is work in cancer, and the work shows that there may be an impact, an influence in some cancers such as colorectal cancer, pancreatic cancer, stomach cancer, and even breast cancer. The gut microbiome may be involved in metabolism of steroid hormones and estrogens that may then have a downstream effect on breast cancer. Hippocrates way back when said all disease begins in the gut, and he might be right. There's more reviews coming out in the literature that the gut microbiome does influence the development of cancer and cancer outcomes. Here is a great review to look at the gut microbiome, what the oncologist ought to know. What is the gut microbiome? The gut microbiome refers to the genetic makeup of all microbes that exist within the human gastrointestinal tract, including bacteria, viruses, yeast, protozoa, fungi, and archaea. The gut microbiome contains trillions of microorganisms. They encode 3 million genes, producing thousands of metabolites, these postbiotics, which replace or modulate many of the functions of the human host. And it's really interesting to think that we as humans over millennia have developed in symbiosis with the microbes in the environment, and we have now become this meta-organism, and we have outsourced many of our vital functions to these gut microbiomes, including our metabolism, our digestion, the development of our immune system, the functioning of our immune system. And the gut microbiome, as I've said, has become the subject of a lot of research, and a dysbiotic gut, an unhealthy gut, has been found to be a common feature in many of our chronic diseases. What is a healthy gut microbiome? Well, healthy gut microbiome is classified as one that has high diversity, that has lots of bacteria that produce the metabolites such as short-chain fatty acids. These are anti-inflammatory postbiotics which suppress the growth of gram-negative pathogens. They function as energy sources for the colonocytes as well as other bacteria. They dampen inflammation, and they promote the death of cancer cells. The other interesting fact is that tumors themselves, cancers themselves, have a microbiome. Microbes make up about 25% of the tumor environment, and their presence can promote or block anti-tumor immunity. And it's really interesting to see where these microbes are coming from. They're coming from different parts of the body to these tumors, but also the work that's being done. It's going to be really interesting to see what that crosstalk is between the microbiome of the tumor and our gut microbiome. So very interesting work coming ahead, I'm sure. So as I said, there's work being done with and trying to understand how the gut microbiome might be involved in the development of cancer and cancer prevention. And this is a very busy slide, but just illustrating the complexity of it all. And we've only just scratched the surface as well. But the idea is that the gut microbiome may be a key player to developing and suppressing cancer development. And if we just look at this diagram, this is the wall of the bowel, which is lined with a single layer of colonocytes, the colon cells. On top of the colon cells, there is a layer of mucus, and on top of the mucus, there are microbes in the gut. This here is the lumen of the bowel, and we have residues of what we eat coming through the lumen. We have metabolites of drugs and antibiotics. We might have pathogens coming through here. And if we think about what the healthy gut microbiome might be and what might do, we want a diet that is rich in fiber and plant foods, and that means that we get more fiber residues, more polyphenols coming through the lumen of the gut, and the fiber-loving bacteria work on these residues, and they produce the anti-inflammatory postbiotics, the short-chain fatty acids that I've mentioned. And these short-chain fatty acids, they maintain the integrity of the gut lining. They have downstream anti-inflammatory effects. But conversely, if you have an unhealthy diet, which is high in saturated fats and meat, you're going to get bile-loving bacteria that will produce secondary bile acids in the gut, and these are known to be carcinogenic, and they're implicated in the formation of colorectal cancer. There's other inflammatory metabolites that come from this, and the thinking is that this pattern will then cause a leaky gut, a disruption of the cells that line the gut, and you'll allow pathogens and endotoxins to go through. You'll start this inflammatory cascade, this interaction with the immune cells that sit in the wall of the bowel, and you will promote these inflammatory pathways, promote these cancer-causing pathways, and you will suppress the death of cancer cells as well. About 70% or more of these short-chain fatty acids, the good metabolites, are absorbed into the bloodstream, taken to other areas of the body to help reduce inflammation. And then this is the way we think that metabolites get through to the rest of the body to either cause a good pathway or a negative pathway that may be involved in cancer development. When we look at the gut microbiome signatures of different diet patterns, here is a study from last year, and they looked at the gut microbiomes of vegans and vegetarians and omnivores, and they found that the gut microbiomes differed clearly across the diet patterns. In omnivore microbiomes, they had bacteria that were rich in the meat and dairy digesting and inflammation-linked bacteria. The vegan microbiomes were high in fiber fermenting and butyrate, short-chain fatty acid producing bacteria, which, as we've said, have been linked to reduced inflammation, but also better cardiometabolic health. Fruit and vegetables promote the beneficial gut microbes. Meat and dairy favor the less healthy profiles. The other interesting part of this was that some of the microbes in the gut come directly from food. So dairy bacteria found in cheese and yogurt, for example. Vegans had the fewest food-derived microbes, likely due to excluding the animal products, of course. When they looked at the functions of these microbes, they're finding that, you know, the plant-based nutrition patterns are associated with fiber and polyphenol metabolism, and the omnivores with protein and fat metabolism. They found that the more diverse your plant food intake, the healthier your microbiome, even for omnivores, showing that you can improve your microbiome by including more plant foods, even if you're not 100% vegan or vegetarian. This is a really neat study that was published in 2014, which really illustrates how what we eat changes the microbiome in a very short space of time. And this was a collaboration between researchers at the University of Pennsylvania and University in South Africa. And it is noted that rates of colon cancer are much higher in African Americans, 65 for every 100,000 of the population, compared to rural South Africans, which is only 5 out of 100,000 of the population. And this study took 20 African American volunteers and 20 volunteers from rural South Africa. They did colonoscopy and microbiome analysis on these participants, and then they did a swap of their food. So the African Americans, their standard American diet was typically low in fiber, only 12 grams of fiber, high in fat, 52% of their calories. Protein was 27% of the calories, and very low in whole carbohydrates, only 21% of calories. In rural South Africa, the African plant-based diet had 55 grams of fiber, low in fat, only 16%, low in protein, and high in whole carbohydrates. 70% of the diet was from whole carbohydrates. So at baseline, the African Americans showed more colon polyps. And this is important because we know that there is a stepwise progression in many of the colon cancers from polyps on to cancer. And 45% of the African Americans had polyps. None of the rural South Africans had polyps. The African Americans had higher inflammation and cell proliferation markers. These are markers linked to cancer development. They had lower levels of the protective gut short-chain fatty acid producing bacteria and lower levels of fecal butyrate. They had higher levels of carcinogenic secondary bile acids and bilophilic bacteria. After just 2 weeks of the diet swap onto the plant-based high fiber, high whole carb diet, the African Americans saw a reduced inflammation and proliferation, improved gut bacteria, higher butyrate levels, lower bilophilic bacteria, and reduced secondary bile acid synthesis. And for the rural South Africans, they completely also flipped their profile, and they showed increased cancer risk markers. So really fascinating to see this and know that we can change the gut microbiome composition in a very short space of time. There is also now an evolving body of evidence of literature which shows demonstrating the role of gut microbiome microbes in modulating the responses to cancer treatment, particularly immunotherapy. So several studies have shown this. Here is one of them. In 2020, there was a study looking at 52 patients with solid tumors, followed for a median of 2 years. It was a variety of solid cancer tumors. They looked at fecal and plasma short-chain fatty acids. In these patients, they were all treated with programmed cell death 1 inhibitors, which is a type of immunotherapy. And those who had high frequency intakes of several sources of dietary fiber, such as green vegetables, cabbage, and mushrooms, had a higher concentration of fecal short-chain fatty acids, as we would expect. And higher concentrations of these fecal short-chain fatty acids were significantly associated with a better progression-free survival. So that's very interesting evidence showing that we can modulate the effect of our cancer treatments by what we eat. So talking now about the guidelines, we have great guidelines from our cancer institutions. This is from 2018 from the World Cancer Research Fund and American Institute of Cancer Research. They give this wonderful infographic. They talk about being a healthy weight, being physically active. They say eat a diet rich in whole grains, vegetables, fruits, and beans. Limit your consumption of fast foods and other processed foods high in fat, starches, or sugars. Limit your consumption of red meat and processed meat. The American Cancer Society, which reflects these guidelines as well, says avoid processed meat. And I think recalling it, they actually say there's no place in a healthy diet for red meat or processed meat. The guidelines also say limit your consumption of sugar sweetened beverages, limit your alcohol consumption. Do not use supplements for cancer prevention. There is no evidence that supplements prevent cancer. If you are a mother, try and breastfeed your baby if you can, because this translates to lower risk of breast cancer in later life. And after a cancer diagnosis, follow these recommendations if you can. They also say that not smoking and avoiding other exposure to tobacco and excess sun are also important in reducing cancer risk. Following these recommendations will likely reduce intakes of salt, saturated fat, and trans fats, which together will help prevent other non-communicable diseases as well. Now, this is also a new report from the World Cancer Research Fund just out less than 2 weeks ago. This is part of their continuous update project. Updates which help review all the literature to guide the recommendations. And this is meant to be supportive evidence for the guidelines that we've just talked about. And they reviewed over 170 studies in breast and colorectal cancer. For overall cancer prevention, it's the same recommendations. They say restrict alcohol consumption, restrict red and processed meat consumption, prioritize fruit and vegetable consumption, fiber-containing foods, including legumes and whole grains, maintain a healthy body weight, be physically active. They also say, additionally, for breast cancer prevention, avoid alcohol consumption. So they're now saying the evidence suggests that any amount of alcohol increases risk, so it's best not to drink at all. Additional specific recommendations for colorectal cancer says avoid processed meat, Now it says include calcium-containing products such as dairy in your dietary pattern. We know that this is not just for dairy, it's for any calcium-containing food. And I wish that they had clarified that a bit more because this suggests it's just dairy. And they also say include coffee in your dietary pattern because there is evidence that that's helpful in reducing colon cancer risk and also dying from colon cancer. So we have great guidelines, we have great evidence. What about the awareness and adherence to these recommendations? The studies looking at the adherence to guidelines do show that there is actually a benefit for people who are following this and improves their survival. However, when we look at the data, the knowledge about them and adherence is low. We need to do better. We need to do better public health campaigns. We need to educate our health professionals so that when people ask them, when our patients ask us in clinic, we know what to say. And when we look at the studies on this particular aspect, we know that people are asking, they are wanting to know, but they're not always getting that education back again. We also know that what our health professionals advise us is more likely to be taken on as a recommendation in practice. So we do hold a particular place, a trusted role. We need systems level policy and environmental changes to ensure improved access to healthy food that's nutritious and affordable. We do have studies looking at food deserts and food swamps showing that there is an increased risk of cancers when your environment is not conducive to being able to access healthy foods. I'm going to talk a little bit about lifestyle medicine. We've obviously talked about plant-based nutrition, but there are other aspects of our lifestyle that beneficially impact the incidence of cancer and also how we do after diagnosis of cancer. Lifestyle medicine is a medical specialty that uses evidence-based practices in 6 areas of lifestyle behavior: healthful eating, physical activity, stress management, social connection, sleep, and the avoidance of toxic substances and risky behaviors. And it's the fastest growing medical specialty globally. Its flagship organization is the American College of Lifestyle Medicine. I encourage everybody to check that out if you have not already. Their dietary pattern promotes minimally processed vegetables, fruits, whole grains, legumes, nuts, and seeds. And this is their food plate. Half the food plate is fruits and vegetables, a quarter is whole grain, a quarter is plant proteins. They have wonderful resources. Here is one of their resources related to cancer, and they go through different things that we can do that have an evidence base behind them to improve our outcomes. There is if you become a member, you can be part of the different groups. There is a wonderful cancer member interest group amongst the American College of Lifestyle Medicine members, and they have this wonderful toolkit which is available for members, and they go through each of the categories and give specific recommendations depending on how open your patient is to going forward with these recommendations. So this is the dip your toe in. So add 1 serving of plants into each day. So this would be a handful of fruits, vegetables, or whole grains, or a thumb-sized portion of nuts or seeds. Use unsweetened soy milk to make your smoothie. Add in nut butter, spinach, or chia seeds to add more plants. Include brown rice, quinoa, sweet potatoes. Cook large batches for several meals. That really helps people stick to this diet pattern. Instead of animal protein in the evening, go for beans or lentils. Choose crunchy carrot sticks or sweet pineapple chunks for healthy snack option. And then depending if you want to go a bit more deeper, you can wade into the shallow end or you can dive all the way in. So the recommendations or the helpful tips go according to that. The resources that I recommend to my patients include the Cancer Survivors Guide by Dr. Neil Barnard and Jennifer Riley, the Physicians Committee of Responsible Medicine. So Dr. Neil Barnard is obviously the president of the Physicians Committee of Responsible Medicine. They have wonderful free resources on their website. I also recommend this free community guide to cancer nutrition from Gilda's Club Toronto, written by wonderful people based in Toronto, where I live. And this is a fantastic document. It's also accompanied by a freely downloadable recipe book called the Long Table Cookbook. If you want a more deeper dive into the relationship between lifestyle medicine for cancer prevention and survivorship. There's a wonderful course at University of Winchester. In full disclosure, this is coordinated by my amazing sister, Zahra Kassam, but it's a unique course in this aspect. It's 15 hours, it's self-paced, it's all online. If you're a health professional, it is CPD accredited, and for our board certified members of the American Board of Lifestyle Medicine, it does also have CPD, which you can put towards your maintenance of certification. The final thing I'm going to talk about is planetary health and cancer. There is a link between planetary health and individual health. Planetary health, one of the definitions is the health and well-being of humans and the natural environments we depend on. Dr. David Katz, who is the director of the True Health Institute and a past president of the American College of Lifestyle Medicine, says you cannot rightly call yourself a health professional any longer if you don't advocate frequently and fervently for the health of the planet, and I couldn't agree more. There are many human-caused changes to the Earth systems. This is a graphic from the Planetary Health Alliance, a wonderful organization out of Johns Hopkins University. And unfortunately, these consequences of the impact we are having on the planet is having a wide range of health implications. And it is increasing our incidence of cancer as well. And we know that our food system is central to many of our current crises. It's central to our health crisis. Animal agriculture is a leading cause of pandemic risk, antibiotic resistance, which is affecting my patients, affecting all our patients. Animal agriculture is the leading cause of deforestation, land use change, air pollution, water pollution, species extinction. It produces 30%. There's different numbers which are quoted depending on what source you're looking at, but a significant amount of our greenhouse gases are produced by our food system. 30% of all methane is produced by our animal agriculture system, and of course the ethical implications as well. The Eat Lancet Commission says that food is the strongest single lever to optimize human health and environmental sustainability. Our medical organizations are recognizing the same thing. Here is the statement from the American Medical Organization last year, which recognizes that animal-based agriculture is a significant contributor to greenhouse gases and supports efforts to increase and promote plant-based menu options in hospital food service for both health and environmental reasons. With respect to cancer, climate change is going to be accompanied by higher rates of cancer, especially lung cancer, skin cancer, GI cancers. And the biggest threats or the biggest reasons for this are going to include air pollution, exposure to UV radiation, industrial toxins, and also disruptions in our food and water supply. Communities are going to have more difficulty accessing the healthful foods that we've talked about today. And in addition, when you have extreme weather events, you're going to have disruption of the complex healthcare systems that are required for cancer management. And we're seeing this already. In North America, we've seen flooding and hurricanes, and we're seeing that interrupting patients during their cancer treatment because people can't access the care now, can't get to the cancer centers, is actually going to impact their outcomes. It's going to be making that negative impact of changing a curative treatment to then becoming non-curative. So there are major implications. The Lancet Commission on Food, Planet and the Health, they published their report in 2019. This was a report by 37 experts from 16 countries, and they were looking at what food pattern will help to feed 10 billion people, which is the projected population in 2050, to stay within planetary boundaries. And they have a plant predominant plate. They say you don't have to eat animal products, but if you do, a maximum of 13% of your calories should come from animal products. And following this diet will save 11 million premature deaths per year and keep us within planetary boundaries. And we will watch this space as version 2.0 is coming out in October this year. We have a number of studies now coming out looking at health outcomes compared to the Eat Lancet Planetary Plate in terms of cancer. This study it came out in 2021. This is from the EPIC study, the European Prospective Investigation of Cancer and Nutrition. It's looking at 10 countries. The median follow-up in this study was 14 years. 440,000 participants, and they used the Eat Lancet as Planetary Health Diet as their reference, and they found that greater adherence resulted in 19 to 63% reduction in all-cause mortality. 10 to 39% of all cancers could be prevented, and it reduced greenhouse emissions by up to 50% and land use by up to 62%. So lots of co-benefits for eating a more plant-based dietary pattern. So in summary, I hope I've convinced you that a proportion of cancers are preventable. The plant-based nutrition can decrease the incidence of cancer. It can improve cancer outcomes after a diagnosis. We see that international guidelines support plant-based nutrition, and we also know that plant-based nutrition has co-benefits for individual and planetary health. Thank you so much for your attention. If you want to contact me, my email address is here, plantbasedcanada.org@gmail.com. Please do check out our 2 books. We have lots of information in there for a deeper dive into the evidence behind plant-based nutrition. Thank you.
Great. Thank you so much, Dr. Kassam. That was a very thorough presentation. So first, with regard to your books, would they get your books through the website?
Our books are on most booksellers. The publisher is Hammersmith Books. You can get them from there as well, but all the major booksellers have them.
All right, great. So jumping right into the questions. So a lot of great information, and a lot of people learn this stuff, and it can definitely be quite overwhelming to make healthy changes, especially when we've been, I think most people don't even know how to cook anymore, right? Or at least many people don't even know how to cook, or they think, boiling pasta and opening a jar of pasta sauce is cooking, right? So how do we make this type of lifestyle change accessible to people so that they can actually implement it in their lives and then see these health benefits?
I do say to my patients that, obviously whenever we're talking to people, we want to be a bit curious and find out where they are, and your recommendations are going to come from where they're starting at. And you're right, some people, there's a lot of work to be done. And I do say to my patients that small changes can have big benefits. And we know this from the study. Even if you change 3% of your animal protein and substitute it with a plant protein, you're going to see a benefit. So I ask people just to do simple things that they think that's going to be sustainable for them. So adding in some fruits and vegetables. We go through all the fruits and vegetables that they like. Some people say, I don't like fruits and vegetables. You can always find something that they like. I do talk about smoothies as well as a great way to improve health. And I say, do you think you could have a smoothie? Because that's a great way to start the day, and you've already got lots of your great phytonutrients to start off the day, and you can feel really good about yourself. And I love Brooke Goldner's hyper-nourishing smoothie, which has spinach and mango and flax and chia and banana in it. So I try to come at it from where patients are. We try and figure out small changes that are going to be sustainable. There's always something to do. And you're right, cooking, we don't have the cooking skills that we used to, but you don't actually have to. There's a lot of mixing that can be done. You can get some great plant-based meals in short space of time, and there's loads of recipes online. There's cooking on a budget. The information is so available now to us.
So just speaking about Dr. Goldner, she's actually on next right after you. So if you like her, you're welcome to stay and watch her presentation. She does a really great job. So you mentioned that 50% of cancer is lifestyle. And then you mentioned that 5 to 10% is genetic. What's the other percentage from?
So do you mean other than the lifestyle and other than the familial genes?
Yes.
So these are going to be things that some of which we don't really know, but some of it's going to be the environment that we live in, the toxins, the pesticides. We didn't really talk about organic foods, but there is some data showing that perhaps more organic foods might reduce cancer risk. But we live in a very polluted world. and other implicated factors might be medications, for example, infections, for example. So things like hepatitis can increase your risk of liver disease. H. pylori can increase your risk of stomach cancer. So there's lots of other pieces to it. But I think it's important to focus on the bits that we can control, and that there's a large portion of it that we can control. And also the important thing to say to people, whenever I talk to my patients is I really try and emphasize that it's so multifactorial. We can't say, oh, you got this cancer because you did this. It's not like that. It's not about blaming people. But what we do know is what you do after a diagnosis can really help you do better.
So, as one of my questions I have about pesticides and microplastics. So things like glyphosate and what is it, astrocide, or I forget the exact name of it. We had a speaker talk about it. So what is the role of those types of pesticides in cancer, according to the research that you've reviewed?
So the World Health Organization has labeled glyphosate, diazoxide, malathion as probable carcinogens. So we've known that for a number of years. The data on organic food consumption and cancer is pretty limited still, but we have the Million Women study. We have I think it's the Nutrinet-Santi study. And these two studies have shown a link between, so increased organic food is linked with an associated reduction in lymphomas. One of the studies showed a reduced link with breast cancer, but that was not replicated in the other study. So it's early data. And the difficulty, I think we don't know for sure. So we've got, at face value, given that these are carcinogens, we can see whether we can try and choose some organic foods. And because organic foods can be very expensive, we don't want it to be inaccessible. So the Environmental Working Group in the US, nonprofit, every year does publish the Dirty Dozen and the Clean 15. So we can look at those lists, and we can, the things that are on the Dirty Dozen, we might want to then prioritize getting organic foods from there. But in general, we just have to promote increased fruits and vegetables. If you look at the studies which look at pesticide residues in people and their eating patterns, vegetarians have lower pesticide residues than omnivores do. So we won't get too caught up on it, but there is some suggestion that there is a benefit.
All right, excellent. So Dr. T. Colin Campbell, who is a nutritional biochemist who specializes in cancer. I'm sure you're familiar. Yeah, you can't be in this space without being familiar with his work. In his book called The Future of Nutrition, he starts off talking about the different perspective of a localized view of cancer versus a constitutional view of cancer, where not just like you have this organ and you have, this is where the cancer is. You really have a systemic, versus a systemic problem. What does the research show on that? Does this support the idea of that cancer is just a local phenomenon, or that it's actually a manifestation of constitutional problems?
But totally, I agree that it's a manifestation of systemic problem. And we see, back at the beginning of my presentation, the lifestyle medicine literature demonstrates this quite nicely, that there are similar pathological features that cause negative impacts on the body and then can manifest in different ways. It's the same pathological features that just manifest different disorders in different people. We see that comorbidities go together. We know that the comorbidities of like cardiovascular disease, for example, increases your risk of cancer by 12%, diabetes by even higher. So definitely, I 100% agree. And that's reflected in the cancer literature, and the understanding of cancer as well has evolved, that it's not just about the tumor itself sitting where it is, which is important too, but it's about the microenvironment around it. So absolutely. And we see from the microbiome research how far-reaching the effects of how we eat can be on inflammation in our body as well. So 100%, I agree with Dr. Campbell, and I wouldn't disagree with him on anything, of course.
You're welcome to disagree with him. We have people who disagree with various things. So it is, we're trying, here we're trying to get at the truth, and we do have people with differing opinions, but I tend to lean toward T. Colin Campbell myself. So you had a slide that for BCM medicine, and there was a term called biobank. You said you talked about biobank participants on the slide. What is a biobank?
So the biobank is it's a group of research. It's been going on since about 2006, and it's a cohort of patients. It's got about 500,000 participants now, followed now for many years, and they are producing a lot of data on health outcomes, looking at different lifestyle factors and health outcomes. So lots of great data coming from there. They've got a lot of researchers involved in that. So it's another great database to look at in addition to all our other ones that we know about.
Great, thank you. So one of our speakers, Brian Clement, talks about not eating fruit because it's high in sugar, as well as has some other issues, but mostly the sugar with regard to cancer. What are your thoughts on the impact of fruit consumption and cancer?
So all the studies looking at fruit consumption show a benefit for fruit consumption in reducing the risk of cancer. When we're talking about sugar, we're talking about the free sugars related to sugar sweetened beverages, for example, but the sugar in fruits are combined with all the other wonderful aspects of the fruit, the fiber. So you have a different way of responding in the body. So I do disagree with that. There is no evidence suggesting that fruit is linked to cancer, increased cancer risk. It's quite the opposite. And I want people to eat lots more fruit than we are eating currently.
So we hear a lot about risks with things like biopsies, mammograms, colonoscopies, and even removing a cancerous tumor with regard to with the biopsy, you're opening up the cancer and you might cause it to spread. The removal of the tumor might cause it to spread. Mammograms may have have radiation. Colonoscopies can perforate the colon, and there's other dangers in all of these things. What are your thoughts on the risks versus the benefits of these types of procedures?
So I think we have to look at each of these individually, and in many cases, it does come down to a discussion with your healthcare provider about what your individual risks and benefits might be, and what your tolerance is for accepting some of the risks as well. So when I look at the literature, I do think that there's a benefit for sigmoidoscopies and colonoscopies in helping to prevent colorectal cancer. I think the data is quite significant there. For things like pap smears, again, I think the data is very strong in preventing cervical cancer. For mammograms, the studies originally did show a benefit in terms of overall survival, but the more recent studies are not showing such a great benefit for overall survival. And I think that for breast cancer screening, that really should be, especially for younger people, it should be a discussion with their healthcare provider. We are catching more early stage breast cancers with mammograms, and that does lead to overtreatment and more biopsies, which does have a negative psychological impact on people as well. So I think there is benefit for some people, but I think you could have a discussion with your healthcare provider for that.
How well?
In terms of,
I'm
yeah,
sorry, go
I'm
ahead, please.
sorry.
No, you please continue.
In terms of the other questions about biopsies, perhaps spreading the cancer, I don't think that we have evidence for that at the moment.
Oh, okay. Now, with regard to how well informed healthcare providers are on the risks, there's a lot of issues that that people have. For example, if someone goes and changes to whole food plant-based diet and their tumor, maybe get better, or their numbers in general get better, and they go back to the doctor just has glazed eyes and just turns away and says, "Yeah, that's nice." And they seem to be very poorly informed on a lot of stuff that hasn't kind of been sold to them, if you will. At least that's, my personal view. How do we, I guess, ensure that we have a doctor that's open to these, into even knowing this type of stuff. You can go to medications. We have a speaker, Dr. John Amerson, and he talks about that, that the studies that we're seeing through the peer-reviewed journals are filtered through the lens of pharma, a big pharma, that these journals have a vested interest in providing positive information to big pharma. So how do we ensure that we're talking to a medical professional that is that really is on top of it? You seem to be very aware of the dangers, the risks. You look at the research. You seem to be more open-minded to the totality of evidence. What's your suggestion for people who feel lost and unable to find, good doctors?
Yeah, I mean, healthcare professionals in general are not trained in nutrition, as we know. Um, there is a growing number of people who are aware of this. Healthcare professionals are having to educate themselves after their training has finished. The American College of Lifestyle Medicine is a prime example of this, providing such education. So, I talk to all my friends about trying to get certified and getting their education, but it just points to the fact that it's very much dependent on you to get that additional education. And there's lots of ways to get that through the American College. There's university-based courses now on plant-based nutrition. The University of Winchester has a wonderful 30-hour online course run by my sister again. University of Guelph here in Canada has one. But you're absolutely right. The health professionals are not trained in this, and I come across this all the time. I'll speak to a patient, for example, and then they'll go to their medical oncologist, and the medical oncologist will write in the notes, patient asked me about diet. I told them that there's no link between diet and cancer. And which is infuriating. And we're still seeing myths perpetuated by some of our healthcare professionals about soy, for example, even now. So I try and do some education on the ground, but it's not easy. And we're talking about changing like a really mammoth number of physicians. So we know from some of the studies that healthcare professionals do want to help educate their patients on nutrition, but there are barriers that they've identified, and a key one is knowledge. So we need to try and get this knowledge into the training programs, into medical school, into the other health professional education as well, and also into our training program. That seems to be really difficult to do. There are barriers. We need good leaders who will take that forward. The other angle to come in from it, which I found very useful, is the sustainability angle. So they seem to be more open to learning about plant-based nutrition through that sustainability of the health system, sustainability of the planet, which is why I try and bring that into my presentations as well. But yes, it's a big issue. American College of Lifestyle Medicine doing a fantastic job. And in Canada, for example, we have a growing number of really passionate lifestyle medicine trained physicians who are fully on board with plant-based nutrition. We have great lifestyle medicine clinics actually in Canada as well. So I normally point my patients to that. In America, you have, the Plantation Project, plant-based healthcare directory as well. But again, lots more work needs to be done. I'm not sure I've answered that very well, but I think the bottom line is we need to do better.
So you mentioned issues with early detection, and I wanted to get your opinion on how early detection and then the treatment of cancers that, I guess they're even called stage 0 cancers, may skew the success rate of treatments, given that people may have died with their cancer, not of their cancer. What are your thoughts on that?
I think that's very well recognized in oncology circles. For example, we've talked about mammograms picking up very early stage, so DCIS, so we call that the pre-invasive cancer, stage 0 cancer, and that you're treating people who perhaps will not ever have a problem for that. The difficulty is that we don't know who will have a problem and who won't. But there are ongoing studies looking at de-escalation of treatments in these settings as well. So I think there is an acknowledgement of this. For things like colorectal cancer, where we know that there is a very stepwise progression from developing polyps, and then that can then go on to develop cancer. We know by removing those polyps, you can really help reduce the risk of getting colorectal cancer. So I think it's very cancer dependent. Breast cancer is one of the big areas. Prostate cancer is the other one where you're able to pick up prostate cancer just by doing a blood test now with the PSA markers. So again, I think it's increasingly recognized amongst healthcare professionals, but it does involve a nuanced discussion between you and as the patient and your healthcare provider.
How do your colleagues respond to this type of evidence that you laid out for us today?
I found that my colleagues actually, my immediate colleagues are very open, and I'm finding that I'm being invited more into those spaces, which I don't think I would have been, 5 years ago. So this year now, there's an oncology day for one of my hospitals, and I'm talking about cancer and nutrition. This is not to a vegan audience. No, none of them are vegan. I'm talking to the Ontario-based radiation oncologists later in June. I was invited to do that. So I think people are open to it. But I think, for health professionals, they need to see the evidence. And this is why, I try and make my presentations really evidence-based. The book that my sister and I wrote is very evidence-based. We've got 70 pages of the 280 pages, a list of references. So I think that's very helpful. And I think as a health professional, I have a privileged position to be able to read the literature, interpret the literature, and then share the literature with the public and with my health professional colleagues as well. So I think they are open to it. There's also people who are very not open to it. So I try and concentrate on the people who are, because we all have limited time and limited energy, and there's lots to do. So going down the path where people are open is good.
And how do your patients respond when they hear this? Do they feel like, wow, there's a way for me to take control of it myself, or do they feel like it's a burden?
Most of my patients are so open to it. They bring it up even before I have. And when I started talking to this about this to my patients a few years ago, there'd be some times that I would be speaking about the radiation, what we're going to do, all these side effects that we were going to do to people, and people would be looking at me, frowning and their arms crossed, and I think, oh my goodness, can I bring up food and then talk about lifestyle after this? They just clearly want to just leave the conversation, understandably. And I've just found that it's such a great way to connect with people as well. So people love talking about lifestyle. I find, and it's a great way for connection, and that has such a great downstream effect in terms of the trust that you develop. And I get to find out about my patients as well. I love people. I love finding out what makes them tick and how things are for them. So I found that they're very open to it. They ask me. I always ask permission. Ask me. I always ask permission. Can I please speak to you about lifestyle factors that's going to make you feel better during the treatment and help you do better? And everybody says yes. Some of my patients will then say, listen, I'm not giving up my red meat at all. I'll just tell you now, they say. And we talk about the fact that that's okay. Small changes are going to make big differences. So I say, if you can just reduce your portions a bit, you're going to see a benefit. So even the people who don't want to take on very much of it, we can do something.
So we just have about a minute or so left. What are your thoughts on the difference between raw and cooked foods on a plant-based
I
diet
think
with cancer?
there's benefits to both. So I think we should focus on having both in our diet. I think raw alone, I think it's difficult sometimes to get the calories from that. So um, I think a wide variety of plant-based foods is really the key from all the different groups that we've talked about: fruits, vegetables, whole grains, lentils, beans, chickpeas, nuts and seeds, herbs and spices. And if we concentrate on variety rather than trying to just focus on one stream, I think it's much better the former way.
And with regard to the microbiome, what are your thoughts on probiotics and fermented foods?
So fermented foods, we do see from the research, including the University of Stanford, that fermented foods are beneficial in terms of your microbiome. So I do support that. For probiotics, the data is not really that clear at the moment. I think there's so much we don't understand, and that trying to take a reductionist view of, you know, here we've isolated these probiotics or these microbes and we're going to put them in you and then expect to have a great response. I think the general feeling, if we look at the gastroenterology guidelines, they do suggest that probiotics should only be used in the clinical trial space, and it's not really we can't really recommend it with great evidence behind that it's going to benefit people.
Great. Well, thank you so much for all the information you shared with us, Dr. Kassam. We really appreciate it. It was very thorough and very informative. So
Thank you so much for having me.
Our pleasure. We can unmute the audience so they can share their appreciation, please.
Thank
Thank you so much. That's
Thank
great.
you.
Thank you.
I'm gonna listen back again.
Thank you.
Thank you so much.